we had so much apprehension, it really was almost a non-event because of those rounders who were there to support our staff. And so when we moved to our next phase of bringing live our electronic care decks and our patient access lists and our task lists, we turned to Preceptor again, knowing that those clinical rounders would make a difference. And again, they did. We found that our staff, their apprehension level was down considerably the minute we told them that the blue vests, which is what they wore with their initial go live, would be back, because they knew these were people they could count on, people they could talk with. And frankly, when we went out to the market, when we were doing our clinical documentation implementation 2 years ago, there were very few companies who could even provide clinical rounders. Lots of companies could provide technical rounders, but not those with true clinical backgrounds. And really the sheer numbers that we needed for our clinical documentation, I believe we had maybe even over 160 people here. And so Preceptor was the only one who could step forward and meet that obligation. And so when we looked now forward to our computerized provider order entry documentation project, we turned to Preceptor again, knowing that we needed clinical rounders, hoping that that process was going to work the same for us. And we just had great experience with them, so they really were our vendor of choice.